Now we're going to go over the soft tissue palpations of the posterior spine, hip, pelvis area that I think really apply to the injuries, pathologies that we're going to see most in the lumbar spine, and also a lot of them are going to pertain again to the pelvis, SI, and even some of the hip thigh. So the first thing that we're going to talk about, we're going to start a little bit, actually I think up here in the back, and then we're just going to kind of work our way down. So the one that most people know is the erector spinae, right? These are the big erectors. They help us maintain our upright posture. They're going to start off of our sacrum and off of our iliac crest, and then they extend superiorly. There's 3 of them. We have, hopefully everybody knows, we have the spinalis, we have the iliocostalis, and the longissimus. Spinalis is actually pretty deep and it's difficult to kind of palpate. The longissimus is just lateral to that, and then the iliocostalis, hopefully it makes sense, the iliocostalis comes off your ilium and then goes up to your costals, i.e. your ribs. For the purposes of this class, I'm not going to ask you to be able to differentiate between the 3 when you're palpating, because it's actually really hard to do even if you're good at palpating things and you have lots of experience. And in truth, it doesn't really matter which one of them is messed up because you're going to treat them the same. So in order to palpate that, what you would do is you're going to come down and find their iliac crest, the posterior aspect of it, not all the way out on the sides. I mean, you can start there and then work your way in. And then what you're going to do is just come up a little bit from that, or you can stay right there. And then once you think that you're on them, and I would be at least like an inch off of the spinous processes, if not 2. And then to verify that you're on it, and now this is important, every single time you're going to be testing a muscle, they need to contract the muscle so that way you can verify that you're on it. So I'm on her erectors, and what I'm going to ask her to do is actively extend, so pick her chest up off the table so that way I can feel these. So go ahead and extend for me, and I can feel how these muscles right here are all getting nice and tight. That is how I'm going to verify that I am on these, and it comes all the way down to our iliac crest. Go ahead and lay down. So that's your verification of these particular muscles. Next, what we're going to verify and look at are the Quadratus lumborum. So these, again, are really important muscles for pelvic stabilization and everything. And again, sometimes people have an issue differentiating between these and the erectors because, again, they're both on the back. When they both contract together, they're going to help with extension, but when they contract unilaterally, they're going to help with side bending towards the same side. So what you're going to do is, again, come off that iliac crest. It's a deeper muscle than the erectors as well, and then they come in, and what you need to do is be a little bit more lateral, and then on both sides, palpate, and what you're going to ask them to do is, again, extend, so come up off the table, and you should feel them contract, and now I'm going to ask her, go ahead and lean, so side bend to the right, and I should feel this right side contract, and the left side should relax a little bit, and then if she leans towards me on the left, I'm going to feel this left side contract, and the right side is going to relax a little bit. Go ahead and lay back down. Now, they're not going to fully relax when they do that because she's still in extension, but I could also just have her lay back on the table and then just side bend and see if I can feel them contracting as well to just doubly verify that I'm on those particular muscles. Okay, working south a little bit, we're gonna get to the gluteus maximus. With the gluteus maximus, hopefully everybody knows that guy. It takes up pretty much your entire one side of your buttocks. So sacrum, iliac crest, comes all the way around and it's going to insert onto your greater trochanter. So as we're looking at this muscle, again, make sure that you're telling your patients what you're doing, but as you're gonna palpate this muscle, it's good to just come off their sacrum and then ask them, number 1, biggest, strongest hip extensor. So once you think you're on it, just ask them to extend or pick up their leg, and you should feel it contract really nicely as they do this. Verification that you're on it, go ahead and lay back down, and that is how you're going to be able to get to your glute max. From these, then we're also going to have a couple soft tissue, other things. Actually, let's just do the piriformis so we're done with all the muscles. With the piriformis, this is one of your deep 6 external rotators. It's the biggest of them, and it's the one we talk about the most because it seems to be the one that gets messed up. When you're doing like the figure 4 piriformis stretch, that's the one that you're usually trying to fix. So again, what you're gonna do is you're gonna find that lateral border of your sacrum, get close to the inferior lateral angle and come back up just a little bit. And then this muscle again comes out and inserts on the greater trochanter. So you're gonna kind of want to be in that line. So greater trochanter to here, so kind of in the middle of it. And you should probably feel it. It's a pretty big muscle as well. And then this again is an external rotator. So if we're thinking about, this is internal rotation, remember we're thinking about the thigh, and this is external rotation. So I'm gonna ask her to push against my hand, and I should feel that muscle contract. And she should be able to feel it contract underneath my finger. Great, and then she can relax. And so then the next thing we're gonna palpate from here once we found it is the sciatic nerve. The sciatic nerve, remember, comes out from just right underneath it. So put your finger just south of that and you should feel a band and they're going to feel often pain or numbness or something shooting down their leg, and you can't see her face, but she made a face when I did it. So, and it's pretty, like, your sciatic nerve is a pretty big structure, so it's gonna feel like you're kind of running over TheraBand tubing. Okay, like it's a pretty big thing that you're gonna be able to feel. Now it's gonna take you a little bit to get used to palpating it, but if they don't make a face and if they can't feel some kind of weird nervous thing going down their leg, you're not on that particular nerve. All right, so got all those. Now we're just gonna do a couple ligaments that you guys should be able to palpate. We do have the sacrotuberous ligament. This, again, what you're gonna do is find the lateral border of their sacrum. So come out here, and basically it comes off almost the whole entire lateral border, but again, if you're on the more inferior part, it might be easier for you to find. And then when we talk about this, what you're going to do then is find their ischial tuberosity. So come down, remember I said you just come from the glute fold and push up. And so it really goes between these two. So what you're going to do is find your two borders, and then you are going to palpate right in the middle. Make sure you tell them what you're gonna do, and you're gonna push straight down, and you should feel a structure, again, very solid, and it's not gonna bend. If they were to move their leg around, it wouldn't change anything because it's a ligament, and it is a very thick ligament. Like, it should be bigger than the sciatic nerve when you're running over it, and they should be able to feel it as you're pushing on it. Like, it should feel like a hard structure that you're running over. Very important ligament, you need to know that one. Okay, then we also have the sacrospinous, and when we talk about those, these are really just an extension of the supraspinous ligaments that connect all of the most posterior or superficial spinous processes parts. So as you find those, as you find each of the spinous processes in the sacrum, you're going to feel a little connection. And it's really hard kind of to find in the sacrum, but as you move up from the sacrum into the lumbar spine, you should be able to feel a space, but you can't go straight through in between each one of the spinous processes. You should be able to feel a tension in between them, and that is going to be the supraspinous ligament that is connecting the most superficial aspects of all of the spinous processes as you go down. There is an interspinous ligament that runs in between each of them. Technically speaking, you can palpate them, but usually when we're doing that, we're kind of on the side, and people also make faces when you do it. One of my recommendations, and my nails might actually be pushing the edge of how long they can be, for this class or for any time you're going to be palpating people, it's really important to not have long nails because you're going to be clawing up people's bodies when you do that. So make sure as a clinician that you keep that in mind, because some of the things you're going to have to palpate are going to be pretty deep. All right, thanks.